Ingrid.
Hi.
We got a few questions from staff this month. Can you talk a little bit about the new VoIP process with our new Epic calling, and if we're getting new phones or if there's anything else coming with the Epic calling?
Yeah, so hopefully everyone's aware of the changes that have happened there and that we're able to call through Epic now, which is a nice little click button instead of having to go outside of it, which is lovely. I think it's working a lot easier for most people. We aren't getting any new phones that I'm aware of. We are replacing any phones that are damaged like we always would, but no other changes with the actual equipment or devices. There were some initial kinks, but I think we've worked them all out yet so far, and if you're experiencing something, just make sure to escalate.
Thanks. And we got new little fancy stickers on
our
phones.
We did, yeah. So that is really just to indicate when we're on our work phones, and that kind of is a continuation of that no distraction November, focus forward February, just making sure that we're keeping our personal devices and earbuds elsewhere.
Okay. And then we had a couple other questions, but the basic concept is what's happening around here? What's our top priorities? What's coming?
Yeah. So we have lots of go lives happening in April that I'm excited to share about. So this week we went live with the mobility pilot. So this is really looking again as a length of stay initiative. So looking at how can we mobilize our patients more, because we know that when we move our patients more, they're less likely to go to like an acute LTAC or a SNF or some other facility. They're able to go back home. So that pilot started this week, and we're excited to see kind of the results of that. We also started our wound prevalence audits. So that's something that our wound care team has taken on and is really exciting to help prevent any pressure injuries, because we know that that's a huge focus for us this year, along with length of stay. Hopefully you'll have noticed that the Med Intermediate went live with their Tier 1 huddle in early March, and then the rest of the units, as well as the ED and ICU, are going live with Unit 1 huddles on 4/1. And several of the other ancillary areas are also going live, like radiology and rehab. And the intent there is to really have a good flow of information in an escalation process. So there's a binder now that has all sorts of education on important dates. And again, that's intended to be in place before World Cup and to make sure that we have a great way to share information and be ready for our shift in front of us. The last thing that is kind of a new change is related to some alternative care areas for our ICU patients. So we are able now to formally put a select number of diagnoses into CVRU that are considered low acuity ICU, and that will start on 4/6. And that is, again, prepping for whatever is yet to come with World Cup or other things, and just helping us make sure that we have the ability to take care of our patients.
Okay, so that was all the things with nursing. What about what we're doing around the building or with our facility?
Yeah, so hopefully you guys saw the announcement that we're getting a new president. She starts on 4/16. Her name's Monica Smith, and she's coming from MOVAP. She was a COO there for years, and then also spent some time in Columbia at one of the hospitals there as well, so that's exciting. I know I keep getting lots of questions about the 6th floor and the expansion that we have. It's still in initial approvals. So one of the great things that we've been able to gain as part of our integration has been access to more capital. And St. Luke's North, St. Luke's Hospital, and St. Luke's East all had really big capital expansion projects that were approved over the 26-27 capital year. So North is starting with their go live that's expanding their ED and building some towers there. And so we're kind of phasing that out. So we are slated still to have everything occur. We're just waiting kind of for North to get started and then to go from there. And then I also get lots of questions about the World Cup. So hopefully you guys all know that it's a 45-day period spanning between June and July. We've limited PTO, we've added extra shifts to make sure that we're staffed up and have the ability to take care of whoever comes in. I think it's still a kind of a big question. We've heard, stats of anywhere between 600,000 and 1.2 million people who might be visiting Kansas City during this time, coming early, leaving late, and we are learning what to expect. There's a huge group working on this at the system level, looking at infection prevention and supply chain and staffing and capacity and everything else in between, ambulances, everything. So you should be hearing more in the near future about what those exact plans mean for your department and for you, but also just for you to know that East specifically is working on some micro drills and revising our infection prevention plan and our mass casualty plan, making sure our callback process all looks really, really good. so that we're prepared for whatever comes, since we do know that, you know, bars are going to be serving 23 hours a day, and there's going to be a bus drop-off really near Assembly Summit, and you know, we don't have great public transportation and lots of different languages and cultural you know, like compassion and capability and understanding for whoever comes and what they might need. So figuring all of that out, and you'll hear more soon.
Thanks, Ingrid.